Good morning to everybody watching, and a big thank you to Fergal O'Neill from ATPO for asking me to speak and participate in what should be a very exciting sharing of ideas over the morning in how we can resurge from this COVID crisis in the area of health. My name is Sharon O'Donnell. I'm speaking to you primarily in my experience as a doctor for the last 30 years, but heavily influenced by my role as a mum in the last 20 plus, and in my capacity as a human being for more than 50 years on this earth. The COVID crisis has been a trying one, to say the very least, for humanity, and it has stretched us all beyond our wildest imagination. Never did we think that such a thing could occur, and we've been left reeling by the experience. Our vulnerabilities on earth as human beings have been exposed wildly, particularly in areas such as climate and economics. However, none more so than in health. Over the last century, improvements and developments in health have been moving at an exponential rate, particularly over the last few decades. And we've made massive progress in areas such as chronic disease management, in areas like cardiac health, in areas like kidney health, cancer breakthroughs, screening programs. On the other hand, however, our developments in areas such as transport systems, our increased choice of just about everything, and our obsession with consumerism and instant gratification has led to a massive growing problem in the human health of the earth, none more prevalent and obvious than in the epidemic of obesity and diabetes. Currently, the WHO states that over 1.6 billion people on Earth are overweight and almost 1 billion are obese, leading to an increased health burden with diabetes, heart disease, osteoarthritis, kidney disease, and increased cancers of all sorts. When COVID came, we were not prepared. It hit us like a ton of bricks. What was already a divergent health system, on the one hand making huge progress in medical treatments and improving longevity, was already battling tirelessly against man's path towards self-destruction. COVID came in the middle of all this. It took a lot of our most vulnerable people, not just our elderly, but those with chronic diseases, those with obesity, those with diabetes, and many other very, very healthy people. What we are left with as we emerge from COVID is all the problems that we were faced with before in our health on Earth, but also many others. We also have a deepening divide. In Ireland alone, what was a two-tier health system has now become a chasm between public and private care. We have a lot of issues that we're left to deal with. We must accept that the health of many people is beyond fixing and beyond repair, and look to the future, how we can improve going forward and have a healthier, less vulnerable population, stronger in the face of any new challenges like COVID. This forum isn't about pointing out the problems. We all know there's a lot of problems, and I'm not here to list them. Don't want to dwell on them. What I want to do is find solutions and put forward my 5 ideas based on my experience and based on knowing what needs urgent attention going forward and what will make the biggest difference to our health. My first idea is fairly basic and fairly simple, and it starts with our children, age 3 going to preschool. Healthy living starts with the basic 5 principles. Get enough air, get enough exercise, eat the right foods, get enough sleep, and drink enough water. Sadly for many, these principles are not taught and not part of the natural existence in homes. So we need with immediate effect to introduce them as a vital part of our education system. My suggestions are, number one, in this first idea, lengthen our school day. They do it in Scandinavia. Incorporate 30 to 40 minutes into the school day of exercise. Teach the children that exercise is part of normal day life. This will keep them healthier going forward and give them a habit of exercising daily. Feed the children a healthy lunch in school. From this, there's another sideline business idea for somebody. Soup is one of the healthiest foods you can give children, or adults in fact. Every day, tons and tons of misshapen vegetables are dumped. Let somebody buy a small van, get all the misshapen vegetables, put them in a pot, cook them in a lovely soup, and sell them to schools. This will feed the children a healthy, nutritious lunch packed with vegetables and teach them that this is a good way to eat. By eating better, they feel better, they have more energy, and they learn to sit around a table, which is a habit that they often don't have at home. Not only will this benefit the children, this will also benefit the parents, who will have healthier, exercised children. The parents can work more if they require, or indeed they can exercise more while the children are at school becoming healthier and exercising. It may stop all the running around for hobbies after school, and potentially there's a business for someone making soup for kitchens, for schools. Idea number 2. Incorporate public exercise areas for adults. All around Ireland and the world, we have playgrounds for children. Children run around gladly, enjoying all the different types of equipment. Let's make them for adults. COVID got us all out walking. For those of us living in the country, enjoying beautiful scenery, we left our house within our 5k and walked, enjoying nature. For those living in cities, not so great. They were stuck, cooped up in apartments. Yes, sometimes they had a park within walking distance, but many bemoaned the idea of not having a gym nearby. Their gym was closed. For any of us who've been to Spain or Portugal, you'll notice that there are lots of public amenities and public gyms scattered along the streets. Often at 7 a.m. you'd see an octogenarian pumping iron on their little stepper on the prom in the early morning sunshine. What about the weather in Ireland, I hear you say? No. It's never an excuse. It's always possible to put on a raincoat and still exercise. Likewise, you can have public exercise facilities that are waterproof, rust-proof, and just put a roof on them. I suggest that they're put in public parks, put on streets, and that legislation is brought in to enforce the need to put a adult gym or exercise area available in any new building development. Insurance is the first thing that comes to mind, and I think these insurance costs should be borne by local councils, and the long-term effects of improving health and accessibility to exercise will cover this cost in the long term. My third idea is a little bit more technical, and those other people speaking today are probably far better placed, but may be able to develop this idea. We need with urgency in the health service a more integrated IT system. This IT system needs to be fluid between health professionals everywhere. So between the hospital and general practice, public health, and allied health professionals like physiotherapy. The shocking archaic nature of reporting systems was really exposed during COVID by the public health doctors, where they had no access to reasonable IT systems that allowed accurate reporting of numbers. This needs fixing as soon as possible. Efficient and accurate sharing of information will improve healthcare with immediate effect. It will improve communication, minimise mistakes, improve efficiencies, and therefore work on clearing the backlog that already existed, but which has been exacerbated massively by COVID. I know the technology already exists, and we need the investment into our health system with alacrity to get this up and running. It's not rocket science, as they say. It exists. It's just a question of implementing it. All these measures are in the end cost saving and will not cost in the long run. Moving from this to idea number 4, the idea of a universal health card. A simple idea like a credit card or a USB storing our most basic health information. I know this idea has been mooted on and off for many years. I don't know what's stopping it. Baseline details such as vital signs, significant medical history and surgical history, a list of medications and allergies to be included on this card. The patient produces it at point of care, allows access to it there and then via fingerprint or face recognition. This technology exists. It's updated by the attending professional and then returned to the patient. GDPR and privacy laws are probably the main inhibitors of this progress. But for goodness sake, look at what we carry around on our phone. We just need to get this going. I know the idea has been developed in recent years in some countries, and for instance in India they developed a scheme called the RSBY National Scheme and Smart Card. This collected a colossal amount of biometric data and developed this idea. I know it's out there, I know it's in discussion, but this idea needs to be brought forward. It will immediately improve communication, efficiencies, reduce mistakes, improve the waiting times with immediate effect, and reduce duplication and waste in the health service, therefore be a cost-saving measure. Fifth and final idea is a simple one again and develops from the Community on Call initiative that emerged during COVID, where isolated and vulnerable people were allowed to ring a phone number to get help when they needed it, be it collecting a prescription or getting their groceries delivered or getting them a lift to a doctor's appointment. The vulnerable, isolated and insecure are not only existing during COVID. They are here all the time. I see people every week who can't afford to get a taxi to see me, but they don't have anyone to get a lift. They struggle to pay €8 to come to their appointment and go home again. This may seem unbelievable, but it exists. There are many people who spent months in isolation in COVID with very few people visiting or talking to them. The idea of a community on call needs to be continued. A voluntary database of helpful, happy volunteers who want to help and engage with others needs to be set up. There are many people I encounter on a weekly basis who have mental health problems, who are socially isolated, and on an equal and opposite basis, there are many people I meet who are keen to help, who just don't know where to start. So we need to marry these ideas, we need to marry these people together and create an easily accessible database to allow this to happen. That is my time. That is my 5 ideas. I hope that we can work together to maybe get some of these ideas up and running. I look forward to hearing everyone else's ideas. I think this is a very exciting forum. I think there's great positivity in the future, but we do need to make significant changes. And I wish everyone the best and enjoy the rest of the conference. And thank you once again for inviting me to participate.